3 groups of people who should get regular HIV tests. An HIV test is an important tool for early diagnosis of the disease, which in turn helps patients receive timely treatment, improve treatment effectiveness, prolong life expectancy, live a meaningful life for society, and reduce the risk of transmission. 1. People who engage in unprotected sex, anal or vaginal sex without a condom with someone who is not your spouse. This includes both homosexual, heterosexual, or relationships with people who have multiple partners. 1. People who engage in unprotected sex, meaning not using a condom or using a condom but not using it correctly, with someone who injects drugs or with people who have sex with many other people. 2. People who inject drugs. Injecting drugs and sharing needles with others. Sharing needles is a common way to transmit HIV. 3. People who have contact with people living with HIV. People who have sex with someone living with HIV. The risk of HIV transmission is high if safe protective measures are not used. 3. People who have contact with people living with HIV. People who come into contact with the blood or bodily fluids of someone living with HIV. For example, people who care for people living with HIV, healthcare workers working in HIV treatment. Please note HIV testing is completely free and confidential. You can go to public health facilities or reputable private clinics to get tested. Your HIV test results will be kept confidential and will only be shared with your consent. If your test result is positive, you will receive free counseling and support. In addition to the 3 groups above, people with other risk factors such as having a history of sexually transmitted diseases (STDs), using stimulants or drugs, having contact with someone with HIV, having contact with the blood or bodily fluids of someone with HIV,